Okay, I hope everybody can hear us now. I'm terribly sorry about that. That's our first glitch for the day. Let's hope it's our last. Good afternoon. It is my absolute delight to welcome you today. And I think there's about 204 of you online, which we're really, really excited about. Welcome to the launch of Queensland's first Clinical Hub. The first Clinical Hub has been developed for each and every single one of you. So before I start, I'd like to welcome some of our guests, and our first guest here is Liza Jane McBride she's the Chief Allied Health Officer here in Queensland. They are a great partner of ours, and certainly someone that has worked very, very hard as well to get this off the ground for you. So first of all, I would like to introduce today the chair of today's webinar, and she is truly amazing, a great Queenslander, a great Australian, and the chair of today, and of course a great friend of mine. For those who know us best recently, it is the Nat and Rob show. For those who know her, she is a relentless advocate for great health, sports, being mindful and being just the best that you can be. Of course, it's Natalie Cook, 5-time Olympian and Olympian gold medalist, Executive Director at Sport and Rec. Nat is a high performance speaker and loves to motivate everybody, and she motivates me each and every time I see her. And she loves to see everybody maximise their full potential. It is truly a delight for all of us to have Nat leading us today. Welcome, Natalie Cook.
Thank you so much, Robin. And yes, the Nat and Robin show was a delight. We are all dressed up today, though, for a bit more formal discussions around health and wellbeing in Queensland. We had a lot of fun with Boost Your Healthy and the 10,000 Step Challenge, and we're very excited to be going to our first Clinicians Hub. And welcome, special welcome to our expert panel. We have with us, of course, the CEO of Health and Wellbeing Queensland, Dr. Robin Littlewood, who is the guru. Well, there's plenty of gurus, okay? So, and they'll all get upset when I call them gurus, but they are very experienced leaders in research, clinicians, academic, educators. Robin now is an athlete too. We're going to call you that as well, Robin, and a chef.
Thank you.
And has worked extensively across all levels of paediatric obesity prevention, which of course is the big topic today. Nutrition, dietetics, and working with children and families on how we make healthier happen for Queensland and Queensland families. We also have Professor Jenny Batch, who is choosing to stand today because I'm sure at some point Jenny will break into movement, which is also really important as we talk about food choices and moving our body. A paediatric and adolescent endocrinologist. Lucky I went to school so I could pronounce that. I'm looking forward to hearing more about that, Professor Jenny, who has been involved in setting up the endocrinology department in 2014 at Greenslopes Specialist Centre to provide that expert paediatric endocrinology service for children, adolescents and young people. We also have Chief Allied Health Officer Liza Jane McBride for Queensland Health, and Liza and I went to physiotherapy school together. How many years ago? I can't even remember, and we won't count, but I'm very excited to have you here, Liza, who's been involved in health management and an adjunct professor at the Faculty of Health and Behavioural Sciences at UQ, associate clinical professor in the School of Clinical Sciences, a Faculty of Health at QT. This is all more mouthfuls than being an Olympian, so I'm glad I had the simple one. You are also responsible 5 times, yes. Well, I think you've got 5 university titles there. And you are now responsible for delivering statewide service and workforce reform and education strategies to ensure that the allied health service meets the needs for all Queenslanders. So we have the 3 women on the panel, and then we had to balance it out with, of course, the amazing Preston Campbell, who delivered our acknowledgement to country. I hope we heard that. If we didn't, it would be a great mime for us. So I would like to acknowledge the traditional custodians of the land today, and our elders past, emerging, and past, present, and emerging. See, that's why you were the one leading that, Preston. So, former professional rugby league footballer, strong commitment to community development, of course, and youth work, and a large part of that being delivered in urban and regional Indigenous communities. So in 2016, Preston established the Preston Campbell Foundation. It's an absolute pleasure to have you all with us today. So that took a long time to explain the awesomeness we have on today's panel. I'll go into a little bit of housekeeping before we throw to the panel and hear what we're all here to listen to today. So there are questions available for you. Hopefully I will get to those at the end, time permitting. If you'd like to ask a question, please use the chat function. And of course, the webinar is being recorded and details will be provided at the end of the session. And you'll see on the screen, if you would like to contact Health and Wellbeing Queensland, there's an email there for both Joanna and Oliver and the main info line. So without further ado, I will get us started with our first speaker, who's going to introduce Health and Wellbeing Queensland and its importance to our great state, Dr. Robert Littlewood.
Thank you. Thank you, Nat. Feels so funny to have 6 of us in the room. Actually, it does feel nice, though, I must admit. So welcome again. I'd like to say, first of all, for those who don't know, I've been the Chief Executive here now for about the past 7 months. It is the most amazing place I have ever been. I feel like now I've been here for about 25 years. We are truly independent. We are a stat body, and we turned a year old around about a week ago. We've got our own board and we've got our own act. And we are here because of a lot of you. So there was so much advocacy around this. So because of you, we've done this. So today we just wanted to be here and share this with you. Our remit is chronic disease and equity. We've got to start this looking at physical activity, nutrition, and obesity. The 3 themes, we've got 3 very, very strong themes that we want to drive everything through. One of those is looking at population. So this is for absolutely everybody. So this is about the people, this is about the children, this is about families, and this is around communities. Secondly, this is around prevention. This is a truly big, dedicated prevention agenda, which is what I absolutely love and we absolutely need here in Queensland. Thirdly, this is about partnership, and we know we can't do anything without you. We need to partner. We need to partner with clinicians. We need to partner with departments. We need to partner across government. We need to partner with industry. The GPs are incredibly important here. Allied health, absolutely incredibly important here. So we're going to start with, first of all, that there's going to be a great deal of work that we're going to look at around remote food stores. So this is the number one for us and just keeps coming up. It is so important to get this right. The second thing we're going to look at is food security, starting with schools. Looking at a fruit and veggie snack in every school across the state, and looking at the way that we can achieve that at some point into the future. Equity. So the way that we can develop the first Queensland-wide equity framework, which has never been done before. I'm really, really excited about that because that then informs every single thing that we do. The fourth thing, of course, is sports. And with our great partners at Sport and Rec, and like we said, we joke about the Nat and Rob show, but that is just so important that we can do this together, and we absolutely do. And as Nat said, we have so much fun doing it. I can tell you, I've never been in tight so much in my life. So The last thing is our Clinicians Hub, and looking at the things that have been developed. I'm so excited about this. So really elevating that importance around clinical prevention. It is so needed here, and that's with our great partners from RPOC. We are going to wrap research, evaluation and data around every single thing that we do, and we are going to understand, build and drive impact for this state. Our vibe is very, very different. You're going to see we are completely positive, we are empowering and we are supportive. We don't need to lead everything. We want to know the champions that are there. We want to support you and elevate the work that you are doing. Most importantly, we want to be big, we want to be bold, we want to be different, and we want to push the boundaries. That's really, really important. You should not see more of the same here. Most critical thing, we want a better life for all Queenslanders. That's why that's why you have set us up, and that's our job. So we are really, really excited to get started. So Nat, over to you to ask us the really hard questions.
Well, that's exciting, Robin. Brave, big and bold. That's
Great.
Definitely the direction we need to go, and different is probably a great word there too, to see some impact. Before we get into those difficult questions, I'm going to bring up Oliver. We're going to watch a little video together. So Oliver, over to you.
Hi, I'm Robin, Chief Executive from Health. Hi, I'm Robin, Chief Executive from Health and Wellbeing Queensland, and we're on a mission to make healthy happen for children and young people living with obesity in Queensland. 1 in 4 of our Queensland kids are living with overweight or obesity. It's time to act. It's time to empower you, our on-the-ground health professionals and decision makers across all levels of care, to transform health in childhood obesity. That's why, in partnership with Clinical Excellence Queensland, we have created the Model of Care, Queensland's first system-wide strategy to tackle childhood obesity. The Model of Care is a practical how-to guide for prevention, treatment, education and research in childhood obesity. The mission? To deliver the best care to children and their families to prevent and treat obesity. It is here to support you, health professionals, on an individual and team level, and guide health services to create change on a system level. It provides practical information on building healthy lifestyle habits on a population level, including information on health and Wellbeing Queensland initiatives helping to prevent childhood obesity. Health professionals, you will feel empowered and confident to identify, raise the topic of weight with families, identify unhealthy growth and risk of obesity, and treat children most in need with evidence-based guidance and resources. There are clinical decision support tools, including a simple referral pathway and a guide to specialist treatment options. Take your first step to upskilling in best practice prevention and management of childhood obesity by learning from experienced specialists in a digital education platform, Project Echo, and consult a step-by-step guide to start, conduct and translate research with specific tips and examples in childhood obesity for new and experienced researchers alike. All of these initiatives and more, including the Model of Care, are hosted on the Health and Wellbeing Queensland's Clinicians Hub, a digital ecosystem, helping health professionals talk about, identify, prevent and manage childhood obesity with confidence and impact. What if we actually did increase the number of Queenslanders with a healthy weight? It all starts with our children and young people, equally and equitably across Queensland. Together we can make healthy happen. For more on how the Model of Care can help you transform health in childhood obesity, visit our website www.hw.qld.gov.au/hub. Thank you.
So welcome to Clinicians Hub, and it is my great pleasure to be able to launch that video with you today, and I'll hand over to Jo now as well to walk you through some of the more practical aspects of Clinicians Hub, and we've got a video as well to show that with you. That was just a quick overview with Robin, but we'll be walking through some of the finer details as well. And this is such an exciting day, and part of the reason why we're here, and we've developed this in partnership with Clinical Excellence Queensland, with the Allied Health Professions Office of Queensland, and it's a practical digital ecosystem of tools, information and resources to help clinicians across all levels of care, healthcare, tackle childhood obesity. And it's particularly exciting because we're not only launching Clinicians Hub today, but also the second version of the model of care, which is an integrated statewide approach for childhood obesity that was developed previously in partnership with Children's Health Queensland. The model of care is settings-based, and, for example, offers clinical decision support across a range of settings and for health system leaders and decision makers. It's there to help you as health professionals. We'll look at an example now at identifying risk, to walk through the 5 A's paradigm for clinical health professionals, and then even step through to a practical clinical toolkit, which is a hub of resources to support every stage of clinical care for childhood obesity prevention and management. And this toolkit is a first phase. It's going to undergo an extensive co-design process to create pragmatic resources that help clinicians overcome the most common and evidence-based barriers to tackling childhood obesity. And here is an example now of one of those first resources, the Referral Pathway. It's a simple tool for primary healthcare to support quick point-of-care clinical decisions. It's designed to be printed, it's designed to be pasted on your whiteboard or your computer, and has very quick evidence-based clinical actions. If you'd like to become a specialist in clinical prevention and management of childhood obesity, Health and Wellbeing Queensland is launching a Project Echo series for childhood obesity. Project Echo is a guided tele-mentoring, case-based learning model. It's about moving knowledge and not the patients that we are here to serve. We are launching our very first series tomorrow morning, and there is still time to register. You can find the registration link at the bottom of this page, and it will be chaired by Joanna Munro tomorrow. So you're watching today and thinking perhaps, who has done this previously? Who has created a service, evaluated a program, and transformed health and childhood obesity in their local area, and how do I do this? Here is our showcase section. It demonstrates best practice examples of the model of care, starting with our partnership with Children's Health Queensland's Good Start program. They've co-designed and implemented a community-based prevention program and clinical treatment clinic for Maori and Pacific Islander children and families living with obesity. Clinic is the Healthy Kids Hub, and the community-based program is the Healthy Kids, Healthy Families. As the model of care is implemented across Queensland, we hope to explode our showcase section. And so the research guide now, integrating research into any new project or initiative is crucial. We need to measure the system to understand and improve its value. In collaboration with the University of Queensland, we have created a simple step-by-step guide to starting, conducting and translating research with examples specific to childhood obesity. And this guide is for any novice or experienced clinician, researcher, system leader or student. You may have seen this already as we scrolled across and wondered, what on earth is a health transformer? And possibly, how do I become one? Health and Wellbeing Queensland has created a multidisciplinary statewide committee of health transformers dedicated to transforming health for childhood obesity in Queensland in their local area. We've got a committee of 70 strong members, and you can express your interest to become a health transformer on the page there. So back to the research guide now, and research is one of those things that people lead by example, and there's practical case studies within this research guide, particularly for our priority populations, including children and Maori and Pacific Islander populations, as well as Aboriginal and Torres Strait Islander peoples as well. And we'll come to those examples in just a second, just here. So we've got children and young people here, how to engage with them when conducting research. and in partnership with our Good Start program, a field example from their Healthy Kids, Healthy Families program, as well as Griffith University's Match program, which is co-designing a service for Aboriginal and Torres Strait Islander children and families for a healthy weight. So to conclude, we would like to very proudly and in partnership with Clinical Excellence Queensland launch Clinicians Hub and invite you all to explore, use and share its value. We hope it helps improve clinical decisions, create valuable and impactful health services and transform health for children, young people and families across Queensland. Every Queensland child and family has the right to good health, and Clinicians Hub is the first step on that journey for childhood obesity in our great state. This is only the beginning, and be on the lookout for much more to come from Clinicians Hub, and visit www.hw.qld.gov.au//hub. And we'll put that link in the chat as well for you to follow along as we go. So thank you very much, welcome, and I'll hand back over to Natalie.
Well done, Oliver, and congratulations on the Clinicians Hub and, of course, Project Echo. And how cool to be a health transformer. It sounds like we need superheroes out there, and what a fantastic initiative. And I look forward to seeing that showcase explode like you talked about, Oliver. So now, when we speak about tackling childhood obesity, we have to start with Preston, rugby league expert, and the word tackling. Everyone's an expert, right? In this room, we have all of our experts and our gurus. So, Preston, can you tell us about your journey becoming a champion for child health in Queensland?
Well, I guess it started from being a rugby league player. Obviously, I was a professional sports person for, over a decade. And I learned the importance of looking after yourself whilst being an athlete, and given some of the things that you have to go through and how intense some of the training is, your body is really the thing that's looking after you. And if you can look after that the best way you can, I think you're going to be more successful. I was pretty lucky to have a long career, 14 years I've played for, and I put that down to actually looking after myself, eating all the right food. Obviously, no choice but do the physical work. But the thing that was very important also was the recovery and the preparation. Those times where, and the things that people don't really think too much about, like your meditations and your yoga, something that I really took on, especially later on in my career. But I really found out the importance of your body and looking after it. And then I retired. Then I kind of shifted from being a professional sports person to being somebody that's just working in community. And I didn't really have that same routine. I tell people I got paid to train because I love playing rugby league. But I'm over here doing something different. So my body wasn't at the top of the list for things to look after. Yeah. And then after time, and the more I worked in community, I started to see these chronic diseases and wanted to find out why this happens. And it comes down to basically not looking after yourself, not eating well, and not doing the exercise that needs to be done. And I kind of started to figure out why people found it hard, to go to work and live this life, and also look after themselves. I put on about 16 kilos in a number of years, and just really wanted to get back to a health where I felt comfortable with, without having to go out and play 80 minutes every weekend. And I think that's the most important thing for a lot of us. When we think about our health, it's about what we need. It'd be great to be an athlete, very elite athlete, but we don't really need that. We just need to be at a point where we can live that long life and live one that's where we can make a contribution to our family, our workplace, and our communities.
Right. So, Professor Jenny Batch, on that note then, a long life starts with childhood health. Talk to us about your rise in this area.
Okay. Thank you very much, Natalie. Well, when I was a medical student, I thought I was going to train to be an adult physician because it was very interesting and very academic and all that sort of thing. And then I did my paediatrics term, and it was just like a breath of fresh air. And I realised that working with children and families was just what I wanted to do. And apart from being fun, because children are fun, there was such a sense of positivity and hope for the future for the children. And if you worked with children and families, you could achieve so much in terms of helping them with their illnesses, encouraging healthy lifestyle, etc., etc., etc. So that's why I got involved in paediatrics and why I pursued paediatrics as a career. And then I took up endocrinology because it's a fascinating area. It's all intertwined with growth and health and nutrition and maturity and turning into an adult. So it's sort of a fascinating lifespan sort of area. And I started seeing children with weight issues, some very young, older kids and adolescents. And I was really disturbed by what I saw because, you know, some of these young children were on such a trajectory of poor health, even as little children, which then only compounds into adolescence and adulthood, interfering with education, school absenteeism, mental health problems, all of that. And so I started to collaborate with others and do research in the area, and also started to try to advocate for services along with Robin Littlewood and many other people. We went to lots and lots of meetings and etc. I also realised that for a lot of families, this was a intergenerational problem, and it was sometimes there was no expectation that things could be different. So there needed to be a lot of education for the families, even just the basics of nutrition. I was just appalled when I talked to families and they really had no idea at all. So I agree that we need prevention. We need our clinicians to have more resources and more skills, but we also have to empower our families and inspire them to better health.
And Liza Jane, that leads me to you as the Chief Allied Health Guru. How then have you found the journey? We started as physiotherapists together, so how do you get into this type of work?
Space, that's right. So I started as a physiotherapist, and obviously we have great interest in physical activity and sport, both treatment, but also prevention. And as I've worked over the years in a number of policy spaces, I think I'm in the unique position now where we can really start to partner and support actual systems level solutions that are localised, able to be localised, so that we can work with communities, that we can work with local clinicians, but from a really strong evidence base. And that's really what the model of care and the Clinicians Hub is really about, supporting that ongoing access to high quality resources for our clinicians, but also that continuing education and research and evolving evidence base. So, it's really that opportunity to influence at that systems level that I'm really excited about.
And Dr. Robin, I've seen you don the lycra.
Yes.
And be a champion in the athletic space.
Yes.
Where does that passion, and you're so passionate and
Yes.
so committed to this space, talk us through some of that passion.
Oh, look, I think I became a dietitian back 20-something years ago, and I'm just with Professor Batch. It's just, we have lived and breathed this with our kids, and, the families, they absolutely need this support. Everybody wants to do the right thing. So it's just about making sure that they've got the tools to do it. I would say relentless is my favourite word. I think when you believe in something, you've got to be relentless, to the point that just before I left my other role, which I had been there for about 20 odd years, they said to me, can you just stop saying the word obesity all the time, because we're sick of it. My kids have said stop saying it, and my mother has said stop saying it. But this is really, really important for us to make sure that we've got this agenda, and I'm just delighted to be here as a result. The second word, so relentless, very, very important, luck as well. So I've worked with Jenny for a long time, and I was a part of Jenny's journey, and it's been Professor Jenny Batch and Dr. Julie McInerney and Professor Gary Young, and there's just so many others that have done some amazing work here. So really, really standing on the shoulders of giants. I could step in, and the heavy lifting was just done. So for me, it was just a little bit of luck. But then timing as well. I know in 2015, the Clinical Senate was very, very important for us. And I heard Dr. Jeanette Young get up and say, Queensland is now the fattest state, and we have to do something about this. And just at that point, I knew the timing was good. I knew that there was going to be something done. And so for me, being relentless, just being really, really lucky, and make sure that you get your timing right, but also working with these amazing people, these amazing people that, Jenny may have been the one at the beginning that said, we have to do something about this. And being a dietitian who didn't really know what she was doing, I thought, well, that sounds like a really good idea. So it's been since then.
And having an almost 5-year-old daughter myself, and sitting her down for breakfast and fighting for the egg and the healthy toast versus, some of the sugary cereals, I know exactly what it's about. It's that balance too, about exercise, moving the body, getting them off the screens, getting them out there. So, Professor Jenny Batch, then, how do we, as a medical professional, what do you think are our greatest challenges for the clinicians in this space?
Well, I think for a long time, the majority of clinicians have felt powerless in terms of doing anything in terms of obesity prevention or treatment management. And that's through lack of training and lack of confidence, really. And also clinicians, doctors, other clinicians don't want to upset their families, their patients. They don't like to use the obese word. Robin does, but she's special. And it is a sensitive issue, and you do need to know how to approach it as part of general health. And
on that then, how do you? So what would be the first step in approaching that?
I think well, first of all, I think it's not the first thing you say to someone. You get to know them a bit, you get to know the family, and take an interest in their child in general, and talk about sport and physical activity. And if they say, Johnny doesn't like playing sport, and you go, oh, why would that be? Oh, he can't keep up with the others. Oh, why is that? And it sort of just comes out. So you have to be a bit devious and circuitous in all of that.
Psychologists at the same time.
Yeah. But that's what I love about medicine. Mm-hmm. And the other thing is, a lot of people, in particular general practitioners, their time is terribly constrained. They have these 15-minute appointments, and it's difficult in 15 minutes to do much, and certainly difficult to really be able to take a holistic approach in terms of prevention and lifestyle intervention. So I think there's lots of reasons why clinicians have difficulty and lots of challenges, and that's why the Clinicians Hub, with the model of care, the toolkit, the ECHO program, it's so important that clinicians gain that confidence and don't just feel that I can't do anything.
And Preston, being a leader in the health and the Indigenous communities, how do you actually engage with the kids? What are some of the tips and strategies you use and the guys at Deadly Choices use to engage with the kids?
Well, Professor Jenny just touched on it. It's important. Now, obviously, they're going to have their barriers. It's actually a lot easier when you're somebody that they've seen on TV, so the barrier sort of comes down a little bit, but it's basically around building a relationship with these young people, spending enough time with them, finding out who they are, what their interests are, and generally a lot of the stuff that I like to do with them is the stuff that they like doing, you know, and I think you have to be a little innovative when it comes to young people. It's very, very different from when a lot of us were growing up, you know, what they're surrounded by, and a lot of the stuff that they're interested in is new age stuff. So I think for me, it's about catching up. I learn a lot when I hang with young people, but at the end of the day, it's trying to build that relationship and letting them know that you're there for them.
And is it the same philosophy in the family unit and the parents doing what?
Yeah, definitely.
Yeah.
I think when we talk about relationships, is principles that I like to use. And a wise person once said to me that real, meaningful, positive relationships are built on respect and responsibility. You know, and when you can get that down and work really, really hard, because we already have that responsibility for each other, we're almost obliged to help each other in community. But it's that respecting that we tend to have a little bit of trouble with. And not all of us are shown what respect looks like, and we have this different view on it. But respect and responsibility are very, very important ingredients in positive, meaningful relationship, and that's really all you need to show. Spend enough time with them. Again, find out what they like, and share a little bit about yourself. You know, when you can open up and communicate the reasons you're there, and share a little bit about your journey, that's where that relationship starts to build. And we talk about real connection.
Great, real connection, very important. And on that, Liza Jane, what's the real connection with allied health and the model of care and this amazing new Clinicians Hub?
Yes. So allied health are so well placed within the health system, working across multiple sectors to really be at the forefront of identifying and working in that prevention and treatment space, be it in private practice, primary care, community, or the hospital. And I think that as I said before, the Clinicians Hub really provides those resources to empower the allied health workforce, our psychologists, our dietitians, physios, exercise physiologists, to really build their knowledge base around childhood obesity and overweight, and what it is best practice management, because every intervention is an opportunity. You know, every contact with these kids, for whatever therapy purpose, it's an opportunity to connect to the children and their families and start to have this conversation around what does healthy look like, and what does it mean for them, for their life.
And Robin, so what does it look like to you moving forward to prevent childhood obesity? Because you mentioned prevention is really important. And what are some of the enablers in that space?
Oh, look, I think the most important one, hands down, has got to be we've got to actually do it together. So, as I said to you, I've been a dietitian, and I've really tried to move this. And without my friends, without my sports friends, without my doctors, without allied health, without communities, without everybody, you just can't shift the dial here. So, number one, you've got to work. You've got to work together. You have to partner. Number two, you've got to think about this everything at once. So rather than a single thing, this is not linear. This is such a wicked issue that we've got to think about this in a systems way. So we've got to think about the way that we can influence curriculum in schools, around the way that we can think about communities, about the way that we can think about sports and sporting clubs, transport. You know, getting kids out there and moving, and thinking about screen time and sleep and everything else, because we know that things that impact health often sit outside of health. So really thinking about a systems approach. And I guess the last thing is education, and that is for everyone. So that is for consumers, that is for clinicians, and that's why this is really important to make sure clinicians feel comfortable, that they feel confident. They don't. This is the hardest. This is one of the hardest things that you can do. And Jenny's playing it down here. I've seen Jenny, and I have worked with you as well for a long time, and Dr. Anne Kinniston as well, who raised the topic of obesity, but so carefully and the right way, and believe it or not, in such a positive way that people feel that they're being supported, that they're not being judged. This is the best time for you to come and do this. Wow, it's amazing. Good on you. Well done. I've seen that, and it absolutely works. So education, systems, and doing it together, that's the way that we can move it.
And Professor Jenny, then, we've seen clearly talk through relationship, trust, getting to know the family, doing things they're engaged in, and then what? What ultimately, in the model of care, we get through that process. What are some of the things that we talk to families about to help the trajectory you talked about change direction?
I think it's probably, it's a bit like how do you eat an elephant in small pieces. And I think you've got to, you give families practical strategies. When I talk to families and take a diet history, if I can identify one thing that they can change, or, one behaviour, like, get rid of the deep fryer, or, just very practical things. And once you can get that hook, then you can work with that and keep the momentum going, I think. I think that's the way forward. And all of these resources in the Clinician Hub will empower, I hope, clinicians to feel that they can do it.
And I think, Liza Jane, one of the keys is that it is a journey. It's not a destination. It's not one appointment, one discussion. It's a journey. And how do you see allied health, the community pitching in to be at the forefront of this?
Yeah, so allied health work in multidisciplinary teams, and so I think that they have a real critical role to play in supporting sort of the medical interventions, but in reinforcing those positive messages around the necessary behaviour change. And often they are with children and families for longer periods of time, for more than the 15 minutes, and have the opportunity to build those relationships. And so that's why I think it's really important that they also have those skills around the resources that the Clinician Hub provides around what is that evidence base, that we're not, and that we're staying up to date with what the research is telling us. I mean, one of the things that's so fantastic about the Clinicians Hub is the fact that we're using a co-design approach for it, and we're researching that along the way as we go. So, it's not a static resource, and it is going to be designed in such a way that it's going to reflect what the best evidence is, but in a way that clinicians can engage with, and that's really important, I think.
And Preston, to anyone listening today or the recording that want to engage with Aboriginal Torres Strait Islander communities, do you have any special tips or tricks?
No, not really. Honestly, like I said, it's been easy for me, especially in Queensland. A lot of people in Queensland associate with rugby league, so they allow you to put a foot in the door, and it's just what you do from there. Everyone say.
So Robin, that's easy. You just got to put them around. State of origin.
As I would do. I think you have to do more than that, though. I think you may have to
Definitely.
Hold the ball in the right position.
Yeah.
Preston can coach us all on that.
All right, good.
And look, I think sometimes, again, they're interested in things that are different from you, So I'll go to some regional or remote community and, I do what they do.
Yeah.
So that's the best way to get to know people is live the way they live.
Yeah. So what is your inspiration then, Robin? I mean, you've talked about, the passion burning. What's your forward-facing inspiration to continue to tackle childhood obesity?
I think the model of care and Clinicians Hub is so incredibly good because it links prevention and treatment together. So this is the first time. I know that years ago, preventive health was very, very good. Treatment, very, very good. It's just that link. So people can now go, so now I want to go and look for a recipe for something, or
I want to go for treatment, or I want to find a tool around this. They have the same place to go that links prevention and treatment, which I'm really pleased about. I think that it's just a single platform that just has everything, which I think, and you know, looking back for me as a clinician, I would have loved this, because there's so much out there. And you just don't know whether it's good or whether it's bad, and who wrote it, and whether it's credible, or, you know, this is the first time that there's just this one single place to go to, and it's a network as well. With Echo, we can now link into someone who might be in the same community as us, or the same place in the state. So it's just that partnership feel as well around the single platform, but bringing prevention, treatment, research and the data together at the same time. It's amazing.
So we've had lots of questions. Liza Jane Chelsea has actually touched on, as a nutritionalist, she doesn't have a problem talking to people about it, but there's a challenge with this collaboration we all keep talking about, that it's not recognised in the GP network as a team member. So how do you think we start to tackle some of those barriers?
Well, if you thought that childhood obesity was a wicked problem, that integrated primary care, I think we'll pop that as a higher problem. I think what I would say is that there's a lot more, particularly from an allied health perspective, that we can do at really engaging better with the primary healthcare networks. So I know that there are some areas that, some of the primary healthcare networks that are really working hard to try and get better engagement with the allied health professionals within their catchment area. Interestingly, I think one of the positives out of the COVID-19 situation has been that there's been greater communication and collaboration within those sort of primary healthcare networks across all of the providers. So I think at a systems level, that's a bit tricky to do, but certainly at a practical level, Project Echo, that's the platform to really connect with clinicians in your area around these wicked clinical problems. And one of the benefits is that Project Echo, rather than just being this one directional webinar, is that it actually really allows you to establish your networks, your professional networks as well. So the support actually and the relationships outlast the Project Echo series.
Patricia has said, should we be talking about this in front of children? I always try to talk to parents on their own so that the child doesn't feel self-conscious, but it's hard to get that opportunity. So, open to you.
I'll open it to you and then open.
Well, I think it depends on the age of the child. The recommendation is that you talk to the parents of young children because they basically control the child's life and lifestyle. And then for adolescents, you obviously have to talk to the adolescent and the parent perhaps separately. So I think you've got to be sensitive to, I got in my practice, both private and public, I get lots of little smuggled notes in and from the mothers via the nurse or someone to say, please don't use the word fat or obese or anything in front of the child. So you just got to be sensitive. And I often, for all sorts of medical issues, I ask the child to go and sit in the waiting room, because children can pick things up and distort them in their own little mind and can be quite distressed. So I think you've got to be very conscious of that.
And Kirsty here, Robin, says the term obesity is stigmatising. And again, discussing it like today helps break it down. The evidence supports a focus on healthy growth and development for children. So the balance between talking about healthy food choices, healthy movement, how do we go about that?
I think that we absolutely do that. I think that obesity is a chronic disease, and so I think that we've got to think about it as such. I know when I use the term, I use it so carefully as well. So certainly I am not the person that will just blurt it out. I will talk about somebody's weight sitting in the obese range. I follow it up immediately with, you know what, this is fully reversible. Well done for you to come in here and to talk about it with me. It's great that you're here. So in a really, really sensitive way to make sure that they feel the support. I think that you've got to be very careful as well to deliberately not say it if they've heard this at school as well. So otherwise they're going to wonder why you don't use that term. But it's the way that you do it, the supportive way, the words that you use both before and after. And I never ever refer to anybody as obese. Their weight might be sitting in the obese range, but never ever do I say that they are obese. But I love the positive, healthy weight, healthy environment, healthy food, health, absolutely.
And there's been comments around having it more involved in discussions at school and the teachers being involved in that. Is that part of the plan?
Absolutely, it's part of the plan. Teachers, and I will ask Jo as well, I think that we're going to be looking at a Project Echo around this as well, so that we can ensure that the teachers know the way to raise this and to ensure that they feel comfortable around this as well. Because I mean, one thing I have heard every single name that kids have been called, as have you, every single name, and it is not okay. So these kids get to the point where they think that it is okay, and that, some will say to me, it's so much better for me to be called Tank now because it's a better word than what used to be there. And I just think that is just not okay. So it's more that we can empower clinicians, empower the families, and make sure that they know the words to use, but the way to use those as well.
And Preston, in the communities you work in, are you seeing it shift when you actually engage with the kids and the families and you take a trusted relationship? Are you seeing there be changes?
Yeah, definitely. I mean, and it depends on how much time you get to spend with them. And look, a lot of the communities that we visit, they're a week trip, or if we're lucky, we'll do 2 weeks out there. So we get on a plane, we fly back home, and I think you can give them as much guidance, you can give them the tools. You talked about empowerment before, Professor, and at the end of the day, it's up to them. And if you can give them practical tools that they can take away and they can build on it, that's the most important thing. Because as I mentioned, we don't spend a lot of time in community with them, but they're there. And that's why it's important that we have champions in community, those examples that are living that life.
Yeah.
Because as you know, I mean, you'd have fans of yourself. I'm a fan of you back in the day, but a lot of the people we see on TV, we may never get to meet, but for a lot of these young people in community, and these champions in their community, they walk beside them every day. They get to talk to them, they get to touch them. So I think for some of our community champions, they can't underestimate the impact that they can have and how important they are.
That consistency is very, very important. Because one of our comments is stop selling soft drinks.
Yeah, and that's one, yeah. At the end of the day, again, we as consumers, it's one of those things, they keep selling it because we keep buying it. And at the end of the day, again, it comes back to that person, that individual, whether they want to buy it or not. And I want to know, is maybe something you start to lobby at a higher level, but at the end of the day, it's we as the consumers.
I think, as Prof said though, you can do that too. So that can be their first thing. So just see me today, and by next appointment, just cut out the soft drinks. So that might be the number one thing. So rather than thinking about everything, just a single thing, and it might be the fizzy drinks.
It has to be a community thing, though.
Yeah.
It can't come from us. It has to be a community thing.
So, Professor Jenny, are you called a prof? That was cool.
Prof.
Does that mean
Sorry.
I'm allowed to?
Yeah, I think so. Well, I don't know. Is that all right?
Jenny.
Jenny, that's what we are. We seek clarification there. That's good. So, Jenny, you've been involved in this for a long time now. How are you feeling about where it's all moving, and obviously the addition now of Health and Wellbeing Queensland? Is that given you a better outlook on what Queensland might look like?
I'm feeling very optimistic because, you know, the creation of Health and Wellbeing Queensland is a sign, and I always look for signs.
Yeah.
It's a sign that, you know, this is an important issue. It is being recognised. And I'm an optimist. I think you have to be working in health. But I'm optimistic that we can change the future because, you know, the children are our future and we have everything we must do for them. And what I would say is doing nothing is completely impossible. You do nothing, everything will just get worse. So you just have to keep trying and be relentless and optimistic.
Mm. So Liza Jane, how important is this model of care framework in your work in allied health and the Clinicians Hub?
So just incredibly important, and we've been partnering with Robin and are now looking at how do we take the model of care and start to work in a place-based way, primarily initially with our Queensland health clinicians, allied health clinicians, to look at how we can set up the treatment component of the model of care using this really strong evidence base that now sits underneath it. I think it's going to give allied health clinicians the tools that they need to deliver really person-centred, evidence-based care so that we can start to shift the dial in a really consistent way and makes it scalable really across the state, which is the really exciting bit.
Absolutely.
So as we start to bring it to a close, we've heard a few keywords. I want you to leave us all with the one word that you think about when you think about the future of Queensland and making healthy happen over the next 10 years.
One word.
The word that you're going to hang on to and it's going to drive you through, Robin.
Children.
Preston?
Community.
Exciting.
Must.
So we've had some good words. When you play this back and watch it again, because I know you will pull out several words: prevention, optimism, relentless, collaboration. That's really, really important. And it is absolutely a must that we take the future of Queensland's youth, children, all the way through on this trajectory of better health and how they can make healthy happen. It is absolutely a must. And it is all important when you're an Olympian, you have a 4-year plan. Unfortunately, this time it's 5 years for most of them. But we operate on 4-year plans as Olympians for our training and for our preparation and our performance. So if we were to have an opportunity to present Health and Wellbeing Queensland with a gold medal in 12 months' time, how do we know we've won the gold medal in 12 months and we're on the right track?
I would say this is about everybody understanding that we can work together. So there's somewhere that we can go, no matter where we are, where we live, whether we're a consumer, whether we're a clinician, that we are working together. We're all in this together. And we said that before COVID. So, you know, really, really important for us. So for next year, Health and Wellbeing Queensland just rolls off the tongue. Everybody knows about it and everybody's a part of it.
And everybody knows the website to go to, and it's got a good long name. It'll be on there. You'll be able to find that with the dots. And that's where you go for all of your resources, your toolkits, the constant inspiration you need as we all tackle the challenge of childhood obesity and making healthy happen in Queensland. Congratulations, Health and Wellbeing Queensland. Thank you for being with us. Thanks to my expert panel and, of course, the team here for making it all happen.
Thanks,
High five.
Natalie. Cool.
Virtual high